Hi friends, this is Riddhi Joshi and I'm going to talk about the exercise ECG testing. So what is exercise ECG testing? Let's see it. So we are going to see about the exercise ECG testing. So what is exercise ECG testing? It's also known as exercise tolerance test. It's an important diagnostic and prognostic tool for assessment of patient with the cardiac disease, ischemic heart disease, etc. Let's see about the clinical prevalence for the exercise ECG testing or exercise tolerance testing. It is also known as exercise stress test. Routinely, it is used to evaluate the patient with chest pain. Patient is having chest pain on exertion. Especially patient with the ischemic heart disease, we are utilizing the exercise tolerance test or stress test. Some diagnostic indications for exercise testing. So what are diagnostic indications for that? First of all, if we need to assess the chest pain patient is having some coronary artery probability, if the patient is having some arrhythmia, if we are having arrhythmia, for arrhythmia provocation, we are going for stress testing. If the patient is having pre-syncope, so we need to see the symptoms during the exercise ECG testing. Symptoms like lightheadedness, muscle weakness, blurred vision, feeling faint. So these all are the pre-syncope symptoms. So we need to monitor these symptoms during the exercise stress test. If these symptoms occur, we need to terminate this test and refer them to their physician. Let's see some prognostic indication for exercise stress testing or exercise ECG testing. We used for risk stratification of myocardial infarction, especially patient with hypertrophic cardiomyopathy. If we want to evaluate or revascularization of some patient like CABG or some drug treatment like digoxin or procainamide, especially to evaluation the cardiac function, we use the exercise tolerance test. Patient with dilated cardiomyopathy or congestive cardiac failure, we are using the exercise ECG testing to see the prognosis of that patient. Especially to detect the arrhythmia, we are using the exercise ECG testing. So these all are about prognostic indication for exercise ECG testing. Let's see about the protocol and procedure used for this exercise stress test or exercise ECG testing. We always use the Bruce protocol. So in modified Bruce protocol, we have stage 1, 2, 3, 4, 5, 6 and 7. Duration is constant and speed it is going to increase 1.7, 2.5, 3.4, 4.2 and 5.0. And grade will be 0%, 5%, 10, 12, 14, 16 and 18. So this test, it will take 21 minutes to complete. We need to ask the patient to walk on treadmill. If the patient is walking on treadmill, we need to monitor the patient before, during and after the exercise. We need to monitor the heart rate and the blood pressure. We need to take the heart rate and the blood pressure every minute. Blood pressure is taken in every 3 minutes. So every stage 3 minutes we need to take the BP. If it is used in maximum or submaximal stress test, we need to check the protocol. Sometimes we use the Bruce protocol only. Patient is having lower workload than the standard, we are using the modified Bruce protocol for deconditioned people, or patient is having severe coronary artery disease. For that reason, we are using the modified Bruce protocol for. So first of all, in stage 1, 1.7 mile per hour and 10% inclination will be there. We need to increase the speed in each stage. If the patient is taking beta blocker, so there will be blunted heart rate response. So because of this response, we need to discontinue it before the test, but we need to confirm with the physician. If the patient is taking digoxin, it is caused the false positive ST segment abnormality and false positive result will be there. So this digoxin we need to stop before 1 week of the test. See about the exercise stress testing procedure. First of all, we need to connect the echocardiogram machine to the patient, check the resting ECG in sitting and standing position both. Particular T-wave inversion, it may occur as the patient is stand up and start walking on the treadmill. A short period of electric physiographic recording during the hyperventilation is also valuable for identifying the changes which results from hyperventilation and rather than from coronary ischemia. When we are asking the patient to walk on the treadmill, in the simple terms, if the patient is walking on the treadmill, so at that time they are feeling hyperventilation and they are giving some changes in the ECG. It is not due to some coronary ischemia, and that we need to monitor during the procedure. Is during exercise testing. So P wave, here is a PQRST. So P wave is increase in height. As we know that the P wave denotes atrial depolarization. So when we are doing exercise stress testing, so atria get hyper depolarization. So P wave increase in the height. The J point become depressed. This is P, Q, R, S, T, and this is called the J point. So J point will decrease in the height. The J point is always denoted what? We can see that the depress of the J point is due to the late repolarization. Then R wave is decreased in height. R wave is the first positive deflection after the P wave. It represents the ventricular depolarization. So when there is a ventricular depolarization is late, so R wave is decreased in height. Then shortened QT interval. So when there is shortened QT interval, this is called QT interval. So when there is a shortened QT interval, it represents the time between beginning of ventricular depolarization and the end of ventricular repolarization. If we are measuring it from QRS complex and the end of the T wave, so this is called QT interval. When there is a increased heart rate due to the exercise, this QT interval get shortened. T wave decreased in height because ventricular repolarization is decreased and we are giving the exercise. So patient is having a decreased oxygen supply, that's why T wave decrease in the height. ST segment becomes sharply upsloping because some ischemic changes will be there, and because of that it will sharply upsloping in first 3 minutes. Now let's see some abnormal ECG changes during exercise stress testing or exercise ECG testing. There may be ST segment horizontal downslope or upslope depression. In the standard criteria for abnormal ST segment is horizontal or plantar downsloping depression. It may be greater than 1 mm. When there is ST elevation greater than 1 mm, particularly absent of Q wave, it always suggests that patient is having severe coronary artery disease and there will severe chances of poor prognosis. When there is the inverted Q wave, there will always ischemic reaction. So there is ischemia, and that's why we have inverted Q wave. These are all the abnormal ECG changes during exercise. Let's see about some contraindication for exercise testing. First is acute myocardial infarction. If patient is having acute myocardial infarction within 4 to 6 days, there is a contraindicated exercise testing. because during exercise testing, patient may feel ischemic response, or patient may get faint, or sometime if they won't get the treatment, patient may die. If the patient is having unstable angina within 48 hours, so we should not go for the exercise testing. If the patient is having heart failure which is uncontrolled, it is contraindication for that patient. Acute myocarditis, pericarditis, acute systemic infection, deep venous thrombosis, these all are the contraindication for exercise testing. On the continuation of contraindication, the uncontrolled hypertension, for systolic blood pressure it greater than 220 mmHg, diastolic 120 mmHg, then we cannot go for the exercise. We need to stop the exercise. It is contraindication for the patients. Patient is having aortic stenosis, hypertrophic obstructive cardiomyopathy, untreated life-threatening arrhythmia or aortic dissecting aneurysm, and recent aortic surgery. These all are the contraindication for exercise stress testing. As we are physiotherapists, so we need to know when normally we should stop the test. So first of all, when to stop the test? Let's see. In the clinical practice, rarely patient is exercised for 21 minutes to complete the Bruce protocol. At the completion of 9 to 12 minutes, the exercise recording is reaching up to 85% of maximum predicted heart rate range. So it is satisfactory to stop the test. Well-conditioned athlete only can reach up to 21 minutes. The most common reason to stop the exercise test is fatigue, breathlessness, and it is the result of unaccustomed to the exercise. After stopping exercise, we need to continue recording up to the 15 minutes, because at this time there may be some ST segment changes we can note, or some kind of the abnormality we can note. The ST segment changes or arrhythmia may occur during the recovery period, and if we are not aware about this, so we need to check during the exercise testing. Let's see some signs and symptoms so that indicates we need to stop the test. First, if the patient is request to stop because he is having severe fatigue, severe chest pain, dizziness, dyspnea, if the systolic blood pressure is fall greater than 20 mmHg, or rise in systolic blood pressure greater than 300 mmHg, rise in diastolic blood pressure greater than 130 mmHg, ataxia, these all are signs and symptoms that is not helpful for the patient, and we need to stop the test. Reason for stop the test during exercise ECG testing, and that kind of things we can note on the ECG. If the ST segment is depressed greater than 3 mmHg, so it denotes severe coronary artery disease. We need to stop exercise, refer them to the physician immediately. If ST segment elevation greater than 1 mm and they don't have a Q wave in the lead, this is again a sign of myocardial infarction. We need to send them to their physician and stop the exercise. If the patient is having ventricular extrasystoles, ventricular tachycardia, new atrial fibrillation or supraventricular tachycardia, development of right or left bundle branch block, or second or third degree heart block, cardiac arrest, these all are signs and symptoms to stop the exercise disease. First, horizontal ST depression greater than less than 2 mm, downslope ST segment depression, early positive response in 6 minutes, persistent ST depression more than 6 minutes in recovery, ST segment depression in 5 or more limb leads or chest leads, exertional hypotension. These all are finding for the coronary artery disease probability. So when there is ST segment depression, there will be always myocardial infarction, so we need to stop the exercise. Or if the patient is having depression, patient is having ischemia also, so we need to stop the exercise. Early positive response within the 6 minutes means patient is having elevation of ST segments within after the 3 minutes or within 6 minutes. That denotes patient is having some kind of the problem with their heart, so we need to stop the exercise. If ST segment depression is persist for more than 6 minutes after the recovery, that suggests a severe coronary artery disease, severe blockage, so we need to stop the exercise because patient is not getting enough oxygen. So immediately stop exercise, refer to the physician. This is, as a physiotherapist, our duty. If ST segment depression in 5 or more limb leads, it's suggesting severe coronary artery disease. Exertional hypotension, it may lead to some kind of ST segment changes, so we need to stop exercise, refer to the physician. If the patient is having angina-like pain, drop in blood pressure plus ST segment depression with a low workload, it indicates high probability of coronary artery disease, severe blockage. If deeper and more widespread ST depression, more severe and extensive disease. False positive results may occur in the woman, and it is the lower incidence of coronary artery disease in this group. So we need to check this kind of the stuff for exercise ECG testing. Guys, if you have any doubts related to any topics in NPTE or PCE, please let me know in my comment section so I can make videos on that.